We are live. You may begin.
Good evening and welcome, everyone. We are so glad you're here. Thank you for taking the time to join us. We truly appreciate the opportunity to connect with you and make sure your voices are part of this important county-wide public health prioritization effort. Slide. For those of you who wish to join this conversation in Spanish, please call 1-800-805-1150. We hope you'll join us. Next slide. So as the Department of Public Health faces a time of financial uncertainty, it's more important than ever that we take a thoughtful and strategic approach to our work and how we prioritize our efforts. This evening, we'll start by sharing some background about how the department is funded, introduce our key areas of public health work, and then we'll ask you for your input in a short prioritization exercise. Make sure to share your comments in the chat. So throughout the presentation, please share what you're thinking, why this work matters to you. We would love to share it with others. Next slide. So our goals for the session are to help you understand our current budget situation, including the potential loss of funding, especially from the federal government, and to ask you for your input to identify the issues that matter most to you, helping to ensure that our limited resources are focused where they can have the greatest impact. Right. So as we look at our current financial landscape, it's important that we share where our funding comes from and the challenges we're facing. Right now, over 40% of the Department of Public Health's budget comes from federal funds, and 34% comes from state funds, with more than half of the state funding originating from the federal government. About 14% comes from county funds, also known as net county cost or NCC, and the remaining 11% comes from a combination of fees and other local sources. The new federal administration has indicated a shift in priorities, which may significantly impact and reduce funding and key sources of federal and state funds that we rely on. At the same time, Los Angeles County is also facing budgetary challenges of their own and has asked that each department to reduce their county-funded budget by at least 3%. Significant reductions in public health funding would make it impossible to sustain current level of services and programming. In the face of this uncertainty, we are identifying and implementing strategies to maximize efficiencies and prioritize critical public health activities. Next slide. During the next hour, we'll explore different areas of the department's work, assess their importance, and help determine which areas should be prioritized based on their relevance and impact. Your perspectives are essential. They will help shape the direction that we take moving forward and highlight the key areas within public health that need the most focus and attention. These conversations, like the one we're having today, are happening all across the county as part of our effort to gather a wide range of voices. Our goal is to ensure that the department's decisions are informed by the real needs and priorities of the communities that we serve. We expect a diversity of views, and we may not always agree on the priorities, and that's okay. This is really an opportunity for you to share your input and make your voice heard. We encourage you to listen to the information shared today, and where available, use the chat feature to tell us why certain areas of public health work matter most to you. The strength of this process comes from the variety of diverse experiences and insights that are here with us today. Through this process, we will elevate key themes and priorities that have been identified and share them with public health leadership for review and consideration. At this stage, with the financial uncertainty that we're facing, we do not yet know exactly how the priorities identified through this process will be operationalized within our department. However, we are committed to sharing the overall results back with you so you can see how communities across the county have collectively prioritized public health work. Thank you again for taking the time and making space for this important conversation. Next slide. So as we get into this, and as we move forward and to really start to think about how we set priorities, I would like to take a moment to share the mission and vision of LA County Department of Public Health, as they're the heart of what we'll be discussing today. So the Department of Public Health mission is to advance the conditions that support optimal health and well-being, and our vision are healthy people and healthy communities. Next slide. Public health works every day to protect and improve the health of communities. These essential components of a public health system guide our work and where we focus our efforts. This includes tracking health trends, investigating health problems, ensuring access to care and resources, and supporting policies that promote equity and safety. We also partner with community groups, build a strong and diverse workforce, and continuously improve our efforts based on data and community feedback. These core activities shape how we serve the public and strive for healthier and more equitable communities. Next slide. So we have organized our public health work into 9 primary areas of work. We'll walk through each of these areas of work together so that you'll have a better understanding of what they include and how they support community health. After that, we'll invite you to complete a brief survey where you'll be asked to rank these areas of work based on what you believe is most important for your community. Next slide. You will rank the areas of work based on what is most critical. These are the areas that address urgent community needs and have the greatest potential for impact. What are important? These are the areas that still play a big role in public health, but may need more immediate attention. And then those areas that you feel are less urgent. These are valuable efforts, but they can be addressed later or with fewer resources. Next slide. Additionally, as we start to look at the primary areas of work, you'll be asked to score based on these criteria, which includes that you could only score a maximum of 3 areas as most critical, and you must score at least 3 areas as less urgent. We know that public health work is all very important, but this is a prioritization exercise, and so we are going to ask you to follow these guidelines. Next slide. So now I'm going to take some time to review each of the 9 areas of work that are presented here. As we review each one, begin to think about which ones most directly affect you, your family, your friends, and your community. This could be an area where you see the greatest needs, where you've witnessed impact, or where you think the community could benefit from more support and resources. As we go through each of the 9 areas, please take a moment to reflect on what each of these means to you. We encourage you to share in the chat why certain areas feel especially important for you or your community. We want you to be engaged in this process. We want others to hear what you think about these areas of work. Next slide. So in no particular order, we will be starting with preventing and controlling infectious disease. This first area of work is to prevent and control the spread of infectious disease across LA County. This includes tracking diseases through surveillance, responding quickly to outbreaks, educating the public, increasing access to vaccines, and making sure we are prepared to respond to emerging health threats. These efforts include activities like lab testing, contract tracing, outbreak management, and immunization programs, all aimed at keeping our communities safe and healthy. Next slide. The next area is promoting sexual health and reproductive rights. So public health works to promote sexual health and protect reproductive rights by preventing and controlling the spread of HIV and STDs, supporting access to care, and advancing policies. We do this by tracking data, using proven prevention strategies, and coordinating services for testing, treatment, and care. We also work to ensure that people have access to accurate sexual health education and comprehensive reproductive health services, including contraception, abortion, and other timely care so they can make informed choices about their bodies and their lives. Our goal is to support policies and programs that promote health, safety, and reproductive freedom for all. Next slide. Preventing and treating substance use disorders. So this area of work is to prevent and treat substance use by supporting a full range of services, from prevention and harm reduction to treatment and recovery. The goal is to make sure that individuals and communities have access to quality services that are innovative, culturally responsive, and grounded in equity so that people can get the help they need when they need it. Next slide. Promoting healthy communities and healthy people. This area of work is focused on improving the health of neighborhoods by increasing access to the things people need to live healthy lives, like healthy food, parks and safe places to be active, and clean air and water. We work to reduce environmental hazards, support healthier environments, and address social conditions that affect health, aiming to reduce chronic disease and help communities thrive. Next slide. Collecting, analyzing, and sharing public health data. Public health collects and shares data to understand the health of our communities and guide decisions that improve public health. High quality data helps us identify what's working, where more support is needed, and how we can better serve the people of LA County. Next slide. Safety at healthcare facilities. We work to ensure that healthcare facilities are safe for everyone, including patients, workers, and visitors. This includes making sure infection control practices are followed and working with healthcare providers to improve safety, reduce harm, and protect the public's health. Next slide. Responding to and recovering from public health emergencies. We prepare for and respond to emergencies like disease outbreaks, wildfires, and other public health threats by planning ahead, staying ready, and acting quickly when a crisis happens. Our goal is to protect communities and help them recover as safely and quickly as possible. Slide. Advancing worker safety. We work to ensure that all workers have safe and healthy workplaces, especially those in higher risk jobs. This includes partnering with workers and employers to enforce safety standards and provide education on workers' rights and health protections. Next slide. And finally, supporting good health and social outcomes for women, children, and families. We work to improve the health and well-being of women, children, and families across LA County by expanding access to affordable, high-quality early education, providing positive youth development through the support of schools and families, improving pregnancy outcomes and working to reduce the high rates of Black infant and maternal mortality, increasing access to health screenings, treatment, and follow-up services for children, addressing disparities in oral health so that everyone has access to dental care, strengthening community partnerships and policies to prevent violence, support healing, and advance racial equity. Next slide. Okay, so now that we've gone over the 9 areas of work, think about what you've heard and identify the one area where you feel is most essential for improving the health of your community. If you strongly agree that this area is vital, in a moment, we are going to encourage you to mark this as one of your most critical priorities. However, before we begin the activity, let me just pause for a minute to see if there's any comments that we should be sharing.
Thank you, Tiffany. There aren't any comments yet posted in any of the live stream platforms. We do encourage you, if you have thoughts, if you want to share what you think should be the priority areas, or any other feedback you'd like to share. Please put it in the chats in the live stream platforms in the comments section.
Thank you. Yes, please share. I at least have others who may be participating today could read your comments. Next slide. So thank you so much for sticking with us this far. I know I provided a lot of information, but now here's the good stuff, right? The opportunity for you to prioritize these 9 areas of work. So please scan the QR code with your smartphone to access the online form. If you're unable to scan, you can also enter the web address on the slide or use the link shared in the chat. Just a quick reminder, and I'll repeat this a couple times. You can select up to 3 areas as most critical, and you must select at least 3 areas as less urgent. Next slide. So when you open up the form, the first section of the survey will ask you for information about which meeting you are attending. Under the date, please put July 24th. Then select if you're a community member or a representative of an organization. If you are representing an organization, you'll be prompted to share the name of your organization. And then under which meeting are you attending, please put DPH Town Hall. The next section will be where you actually do your ranking. And then there will be one open-ended question.
Tiffany, it might help just to hover over the QR code for a little bit longer. Maybe go back one slide. Yep. Just in case anyone needs it, something.
Yeah, and as a reminder, it should be dropped in the chat, the link, in case folks need it. Okay. Thank you. So for each of these areas of work, as a reminder, you will be ranking using these 3 categories. So most critical, these are the areas that address urgent community needs and have the greatest impact. Important, these areas still play a big role in public health, but may not need immediate attention. And less urgent, these are valuable efforts, but can be addressed later or with fewer resources. As you kind of, start to score each of these, just really think about which of these areas do you believe will have the greatest long-term impact on community health and well-being, and how closely does this area reflect DPH's core mission and vision in serving the community? Next slide. Final reminder, you must you can only score, a maximum of 3 areas as most critical, and you must score at least 3 areas as less urgent. Again, we know all this work is very important, but we need a process to kind of prioritize these areas. Next slide. And then just finally, as you go through, the survey, there will be one question that is open-ended, and we encourage you to give your full honest feedback, which will ask you, from your perspective, what approaches would help ensure that community voices are heard and that critical public health issues get the attention they deserve. So please take a moment to fill that out. Promise it was the only question that is open-ended. Everything else you'll be able just to kind of check the box. Next slide. And then after you get through your prioritization exercise and you answer that final question, please, please, please make sure to click submit. We want to make sure that we are able to record your responses. Additionally, please note the survey will be open for a few hours after this meeting, but it will be closed definitely by tomorrow morning. So please just take your time. It will only take you no more than probably 10 minutes or so, 5 to 10 minutes or so to fill it out, and just make sure to hit submit so those answers are recorded. Next slide. So that is it. We're wrapping up, and maybe we'll go back at the end of this just to put those QR codes up one more time. But thank you so much for your time and attention and your participation. Your input is incredibly important as we work together to identify and move forward on the most critical areas of public health work in our communities. This feedback that we've gathered from this meeting and from across the county will really help to ensure that public health decisions reflect the real needs and priorities of the people we serve. As a next step, we will review and analyze all the results from the sessions and share them publicly so you can see how participants across LA County have ranked the key areas of work. Once again, we just really appreciate you being part of the process. And as a reminder, before you log off, please make sure to complete that survey and hit submit so we can make sure that your voice is counted. Maybe, and I think that's it. Do we want to go back to the QR codes just in case there's a few folks that still need access?
Yeah, it would be great to go back to the QR code. A couple folks are saying that the link isn't working. We had a few people just test it, and it is. So we just want you to see it here to see if you can use a QR code or this link. We'll also put in the Spanish link into the chat in case that is needed. That can be done as well. And we'll just give folks a minute to see how it's going. All right, I don't think we're seeing any more comments get added. The link will stay open tonight, and it will be added to the social media chats for this live stream if you can't see it yet. Okay, last slide, Brett. Thanks.
So that is it. I'm sorry for if there was any technical difficulties. The links should be dropped in, so please, take that opportunity to fill out the survey. And again, just thank you so much for participating today. We hope to see you next time.